So, hello, we have a nice little group tonight. So, thank you for joining. If you don't know me, I'm Lauren Listowskis. I'm the VP of Community at Grit Health. I'm also a cancer survivor and a bereaved caregiver to my mom. And if you are looking for Grit Health's program on preparing for mental health support, then you've landed in the right Zoom room. We have a nice full hour together. We have an awesome guest speaker, and I'm just going to go over a few things with everyone. So this is a Zoom meeting, so you are welcome to participate in a way that's meaningful for you, whether that's on camera, off camera, participating through the chat, that is totally up to you. We do definitely encourage questions in the chat. So you can use the Zoom chat to ask questions openly, publicly, everyone will see them, or you're welcome to message myself or Beth, who is also helping out tonight from Grit Health, if you want to ask your question privately, and then I'll get that over to our speaker. The program tonight is being recorded, so everyone who registered will be notified when it is available for viewing. And like all of our programming at Grit Health, this is meant to be informational only, and any medical decision should always be made between you and your healthcare team. So like I said, questions, comments, anything like that, you can just leave it in the chat. If it's something you want private, you can directly message myself or Beth on the Grit Health team. So with that, we will go ahead and get started. If you don't know, there's your mute button also on the bottom left-hand screen. That is going to be really important that everyone remains muted while our speaker is presenting so that the cameras don't flip around. And you should be able to find your chat button in the bottom toolbar, as well as your stop or start video button. And with that, I will be quiet and I will hand it over to our wonderful speaker, Jenna, who's going to share her screen as well.
All right, so getting into kind of preparing for your mental health journey, are you prepared kind of to start what that is? What does that look like? And today we're really going to focus on the barriers that people face in finding their mental health. And so we are going to start out with who am I and why am I the one that is talking to you today? And for that, so again, my name is Jenna Skelton. I'm an LPC, which means a licensed professional counselor. I have a master's in art therapy as well as counseling. And I currently work in a private practice office out of Murraysville, Pennsylvania, which is right outside of the Pittsburgh area. I have worked in a variety of all different stages and environments of care, from inpatient to outpatient to partial programs, to cancer centers specifically. I've worked in schools, homes, hospitals, offices, gone into businesses, kind of done the whole gamut of things. And I also have personal experience with both cancer and within my family, and being in therapy myself. I'm also one of those people that's gone to multiple therapists and have left those therapists sometimes because I wasn't quite ready for the process of what therapy is and what it pulls from you, but other times because it just wasn't the right fit. So what I'm going to talk about today is I'm going to go over the steps of what it takes to get into mental health treatment. And what I'm going to do is, on each of those steps, I'm going to identify one of the biggest barriers that people face that prevents them from following through with getting into mental health care or getting access to their care. I'm not saying there is only one barrier to each of these steps. I'm just going to focus on the biggest one that I hear about mostly, or that I have faced in accessing care. So step one is just knowing if you are ready for care. So the biggest thing that comes with this is, is people come to therapy for all different reasons. Some people come in because they have a current thing that is happening and they want to, face that head on. Some people come in because they're processing past issues that are impacting them currently. And some people just truly need a place to talk. That is it. They don't know if they want to process from the past. They don't know what they want to process from their current life. They just need a place to talk. Some people truly just don't get an hour to themselves, and this is their space to do that. The biggest thing for feeling the need to come in and talk is being okay with whatever your reason is. If you have this beautiful reason with a bow on top to come into therapy and you feel really confident in that, great. But a lot of people face a ton of self-judgment. And so that's the other piece of knowing if you are ready, is identifying those personal barriers that you have against taking that step into therapy. This goes into a lot of breaking stigma and losing your judgment, both losing your judgment that you have of yourself and that you think other people will have on you. Statistics have gone kind of all over the map since 2020, since our world kind of hit quite the snag that impacted mental health. But in 2021, there's a study that was done that showed that 47% of Americans believe that going to therapy is a sign of weakness. Within that article, they also talked about how people talk about how they just don't feel like their problems are big enough, or they are afraid to show emotion in front of anybody. And so getting past some of these personal barriers of, what you're self-conscious about, feeling, again, being ready for whatever your reason for coming into therapy is, and just being prepared to be vulnerable, are some of those just first steps in identifying and knowing if you are ready. Sometimes knowing those two can be your first kind of break into therapy. A lot of times I have people start talking to me and I just say, like, how are you feeling about coming in today? And we can sometimes start there. And so you can work through some of that, like, judgment, especially if you don't know exactly why you want to be there or why you want to start, or you're working through some of those personal barriers. Sometimes you can start there and say, I have people come in that are like, I don't think I even need to be here. Or they come in and say, I don't think you can even help me. I don't think any of these things. It's not rude. It's not mean. It's not always accurate, right? There are sometimes those chances where you come in, you don't know if it's going to be a helpful environment, but you need to try. And so knowing what those barriers are is super important. The number one barrier that I am going to focus on today is time. Time is one of the biggest things that people talk about when they say that they aren't sure if they're ready to start a mental health process or not, is they say, I don't know when it's going to fit. I don't know how to make time for this. I don't know when I would do my sessions. I have all of these things on my list, and I don't think that I have the time. This is a really hard one, right? Because we don't need time just for sessions, but we also need time to actually make the changes that we want to see. Everyone comes in and they want change immediately, and that is not always the case either. And so that can be another barrier where time comes in, that is, you need the time for sessions and you need the time to make change. No one really likes this, but the answer to this one, and we'll go over some problem solving in a little bit, but the biggest answer to this is that we need to make the time. I talk to clients a lot about time in our days being like a pie chart. We keep all of the pieces, but those pieces get bigger and smaller as we need to prioritize them. And time is one of those things that it is actually malleable. We start to get really rigid with our time, and very fearful with our time, when in reality, it is malleable. We can adjust it, we can change it, and we can make kind of room for those things. So in problem solving it, I want to kind of lay out some specific things to problem solve this barrier. So the first one being prioritize yourself. People start to feel very selfish when it comes to mental health care, and like putting aside an hour each week or every other week or once a month for themselves. And selfishness is not always a bad thing. It's actually sometimes a necessary thing in order to get the care that you actually need to be able to be there for other people. So just prioritizing yourself and prioritizing your needs. For the people who you really don't know how you can create the time, or you're one of those people that you're still kind of struggling over some of the personal barriers that are preventing you from coming into therapy, there are some things that you can do at home that take less time, but are still mental health kind of things, or can start that process for yourself. Um, and so those things that you can do at home, um, journaling, reading, habit tracking, self-care, affirmations, those are all things. We do have a blog on our website that that kind of lays out some of those things. So that link is going to go in the comments, that talks about different ways to do self-care at home, because sometimes everyone overuses the word self-care and no one actually knows what it is or what it entails. So that blog kind of goes through that. There are also apps that provide kind of self-care space, or books. I included the books that are on habits, because I talk about habits in the next step as well. And that's sometimes just an easy place to start when it comes to mental health. And again, a space where you can do that without taking as much time. But also remember, with adjusting and prioritizing your needs with telehealth, you can create some session time in spaces that we couldn't do that before. So I have clients that see me over their lunch hours. We have weekend hours, we have early mornings, late evenings. And so just remembering all of your options when it comes to time. And there was a question that was brought up before about that idea of being rude and asking for exactly what you need. That is one of those personal barriers that comes up, and we start to get intimidated by that. But you need, again, to prioritize your needs. And if that means saying exactly when you can meet and exactly what you need from somebody, and really laying that out in a direct and honest way, or if you're meeting with someone, and we'll get into that in the next session or in the next step, but if you're meeting with someone who isn't actually meeting your needs, that's another thing that we will talk about again in that next category. But any questions on this first kind of step of just identifying if you are ready to start your therapeutic process?
Yeah, thanks, Jenna. So again, just want to remind everyone, you're welcome to drop questions, comments throughout in the chat, and we will pick those up. One thing I was kind of wondering, you mentioned at your practice, a lot of you often have like evening hours or even like weekend hours. Would you say that's pretty common across most practices now?
Yeah, I think that it depends on the practice. And some people, I have noticed that it more depends on a person's actual availability. They only give you their actual availability instead of all of their availability. And so sometimes when you're reaching out, they'll say like, oh, well, I don't have any weekends, but they might just not have any weekends open. Sometimes when that happens, you can ask like, well, is there someone else in your practice, or is there somebody else that I can see in your program that does provide those hours? But most programs, especially going into evenings, this is a field that we have to see people when people are able to see us, and that's not going to be between 9 and 5.
Right. I know just a lot of us living in this cancer world, it can already be so hard to
Right.
try and make it to appointments when you're trying to live life.
Yeah.
So that's really helpful
Yeah.
to know. And kind of one of those little things that you can't put in your excuses to not do this jar.
Right. Right. And I always tell people too, and this is one of those things to advocate for yourself. I always tell people and I'm not downplaying mental health when I say this. I am a mental health therapist. So I'm definitely not downplaying mental health, but I do always tell people to prioritize your medical appointments, especially if you are in the cancer world. Absolutely prioritize those medical appointments and then work some of your other things around that. I say that just because, in mental health, that might be part of finding the right fit, is finding someone who can work around your schedule. That might mean that there's a longer amount of time between your sessions, but I would still rather you make all of those appointments where a lot of those offices are only open from 9 to 5, or 8 to 6, and that can even still be hard. And so like our office, we offer appointments till 9 o'clock at night. Like, and
Right.
so just prioritizing those appointments when that office is only going to be open till 5 or 6. Make those appointments first, and then fit kind of your mental health appointments in and work with your therapist on.
Right. And somebody had wrote in the chat, I just want to point out kudos to them, that they've been really trying to carve out personal time by reading. I try to have an established time to read every day, even if it's only 5 minutes or 30 minutes. And I think that's
Yes.
really great.
Yep, I love that. And especially too, again, like if you're trying to make this decision of if you need this like actual mental health service or not, doing things that are good for your mental health counts. I tell my people who discharge all the time, like, you're losing this hour, but don't actually lose this hour. Fill this hour with something that you do for you because it is so hard, especially right now, to get time to yourself. And so, even just starting there with time to read, time to take a long bath, like instead of your quick shower just to get it done, and fit it into your day. Anything that you do for your mental health is part of this process.
Right. Awesome. Thank you.
Yeah. So going into step 2 is that actual finding of a therapist. And so this can be very, very frustrating for people. And I have 2 specific places to look. So the first one is a site called Psychology Today. So we can put that link in the chat. And I'm actually going to show you if I can hide this bar that's blocking my view. Might move this. So Psychology Today is this site, and I just brought up my own profile because it's mine and I can do that. So this is my profile on Psychology Today. What this site allows you to do is allows you to search for therapists based on, this has city, zip, and name, but you can also search on age, insurances that they take, their location, if they do telehealth or not telehealth. Everyone has like a little picture and a little bit of a like bio on there. You can access your people directly from this site. So you can send an email or give them a phone call directly from this site. When we get to our barrier of this step, that piece of this website is so important and is going to be a huge help when it comes to our barrier. So you can also see it says, what insurances you take. It gives you multiple areas to reach out to the person. It shows their experience, so what they, have specific skills in, and what they have worked in before. I'm flying through this just because it's just an example, but I encourage you guys to poke around on the site whenever. And then it also has like theoretical approaches that people are either certified in or whatnot, and then their geographic location. And again, all of the access in the world of how to reach them. So it is an amazing site that is so beneficial, and helpful in finding the right person for you. I'm going to adjust this just to get my screen back to where I need it, and then I will get it big again. Okay. All right. So that is our first kind of step in finding a therapist, or our first way of doing that. Our second way of doing that is going through your insurance company. And so with this, your best way to kind of approach this is to call the representative. There's a number on the back of your car that you can call. You can also go to insurance websites, and they should have a like my site, or I have the link example for Highmark because I have Highmark insurance, so I know my way around their site the most. So if you want to look in that, when that link comes up, if you go to that link, you can even see that it says like, find a professional, find a doctor, find a professional. And so you can search on there. That's awesome, but I am still a phone call person and will always be a phone call person. And I think that it is best to actually access a person and talk to them. And when we talk more about insurance later, we'll talk about the importance of that as well. When it comes to like asking questions and all of that. But again, we'll get into that when it comes to that third step of this process. and some of the other things we can talk about in those conversations with your representative. But those are your two main ways to access kind of finding a therapist. And our biggest barrier in this category is bandwidth. So bandwidth is the ability to exert mental effort. So it's kind of like cognitive capacity combined with executive functioning, which is important because it allows us to kind of override our built-in bias and engage thinking. So we just talked about one of our barriers being time, and that also coming with, are my problems big enough? And should I be able to problem solve on my own instead of needing a therapist? Those are all kind of those like bias thoughts that come in. And the less bandwidth we have, the harder it is to fight against those thoughts. So when we look at bandwidth, where this kind of plays a role in being a barrier to finding a therapist is that there is a huge number of people that want to be in therapy and a lot smaller of a number of people who actually make their way from wanting to be in therapy to sitting down across from a therapist or doing telehealth across from a therapist. And this is because of the steps that it takes and the bandwidth that it uses to get through from step one to the final step of this. And again, I'm making this an easy step process, right? But what it actually looks like is contacting multiple therapists and not having people respond to you at all, and calling and getting voicemails and calling and getting waitlisted. And that takes it from one step of step two, finding a therapist, to 8 steps within step two. And that's where bandwidth kind of prevents us from following through there, is that it just takes so long. And like we talked about in step one, time is a barrier that we already have coming into this process. And so when it takes even more time to actually find a person, let alone sit down with them, we start to kind of bow out of this process. The other thing that goes into bandwidth and why this is kind of plays a role here is most of the time, if you are looking for mental health treatment, is because you're already going through something in life. And already going through something in life means that you already have limited bandwidth. You're already dealing with lack of motivation, depression symptoms, anxiety symptoms, all of these things that already take a huge hit to your bandwidth. And then we're bringing in this process that's supposed to be creating help for you. And it doesn't always feel like that as you're going through these steps and as your bandwidth is just being hit and hit and hit. And so again, the next slide is going to be kind of problem solving this bandwidth and how to push through some of these barriers that we hit in finding a therapist. But again, just acknowledging that like there are going to be people that don't respond. And that's part of why I love that Psychology Today site, is that you can just send off emails like you're applying for a job. And I know that we want to find a great fit when it comes to finding a therapist. But a lot of times it comes down to kind of that numbers game sometimes, where it's like, all right, I'm going to send these emails, I'm going to send these phone calls. And if I get waitlisted, I'm going to say yes to that waitlist and I'm going to keep looking. And if they come back to you and say, hey, we're ready for you off of our waitlist and you have found someone else, then you just decline politely and move on. Or if you're still on that waitlist and haven't found anyone else, then great. The other thing that goes into bandwidth again is that idea that we don't always find the right fit the first time. This is just like anything, right? Relationships, medications, doctors, friends. It's not always a perfect match right off the bat. And so bandwidth also plays a role in that idea of you could go through all of these steps and finally sit down in front of someone and they're just not your person. They're just not, you're on different pages. They are giving you homework and you don't have time for that, or they're talking, just nonsense that's just not what you're looking for. There are all kinds of things that go into that. It's not that you are a person that therapy doesn't work on, right? It also doesn't mean that you found a bad therapist. There are just sometimes not a right match. This often is where we start to feel like we have to start over. And that can be the biggest hit on our bandwidth. But I do encourage all of you to, again, keep going through this process. And we're about to talk about ways to problem solve that bandwidth so that if that situation comes up, you feel like you can get back into this process and find another person and hopefully sit down across from that. I also encourage people, and I tell my clients this every time we start out, that if you know it's not going to be a good match, talk to your therapist about that. They might have resources for you and be able to help you with a referral or to someone else in their office or to a surrounding office where the work doesn't all get put back on you, but that they can help. And again, it's not being rude, it's not being mean, you're not calling them a bad therapist. It's just simply not a match. And so remembering that you can talk to them as well. But our other ways to kind of problem solve bandwidth, which is our barrier in our second step, is follow through. Kind of preparing to know what this process looks like. It is a process. There are the chances that you're going to hit those walls, but continuing to follow through anyway. I would love if this was a seamless process for everyone. If I had a magic wand, I'd be waving the shit out of it, but I don't. And so just remembering that it is a process just like anything else, and that it's going to take some time. A huge thing that you can do for your bandwidth and controlling your bandwidth is understanding your energy levels. So this is identifying what takes energy away from you versus what gives you energy. If your whole day is filled with activities that take energy away from you, you are not going to be able to sit down after dinner and find a therapist. You're empty. Your bowl is empty. You don't have any bandwidth. And this process, again, takes a little bit of bandwidth. And so identifying kind of, again, what activities take your energy away and what activities give you energy. And this can help you just on a daily basis as well, outside of finding a therapist. Paying attention to that can help balance our days out for bandwidth for any of the other things you have to do, like grocery shopping and laundry and dishes and the things that are just part of our day. This also plays into the next one, which is preparing your time and environment. So creating time and space to take part in this process is really important. If you're distracted by kids asking for snacks and preparing dinner and doing all of these things, or if you're exhausted at the end of the day as you sit down to look on Psychology Today for a therapist, this is not going to be an enjoyable process for you, or it's not even going to be a successful one. I tell clients all the time, set yourself up for success. And what that looks like is finding the right time and space to take part in some of these activities. And again, creating the time and space to do that. So if you are, we had that reader example, if that goes from reading to like, hey, I think I need to take part in this, you might have to, again, adjust your pie pieces, read for the 10 minutes, look for a therapist for 15, and now you still have that same chunk of time, which is a time that you already carved out to be alone or to have kind of some self-time, and you're doing that. I take 1 day a week and I go into the office early. It's not a choice. It is scheduled on my scheduler, whether I need that time or not. I go in an hour or two early so that I can, again, create the space for some of my activities that take more bandwidth than I have at the end of my day. And again, just kind of working that into your schedule so that you have it there. Knowing when to take a break or walk away is always important. That's not, again, just about finding a therapist, but across your day in general. Taking breaks so that you're not continually draining your bandwidth and draining your energy levels, but knowing when to just kind of stop, walk away, and come back to it later. That goes into prioritizing lists. Don't use your bandwidth trying to remember everything that you need to remember. Make your list, prioritize those lists. And sometimes it's even helpful to plan out the time to look for a therapist. Again, that way it's already on your schedule. You plan it at a time that you have a higher bandwidth, and you set yourself up for success there. I have on here getting into habits. Getting into habits just helps us with bandwidth across the board. And again, in that last, the time slide, I had mentioned a couple habit tracking books or books that help us create habits. Excuse me, this is helpful in that anything that is a habit takes a little less energy, right? We're not waking up and thinking, what do I want to do next? Or do I want to go to the gym today? If that is part of your habit, we're drawing less bandwidth away from you to make the decision or not. It's already worked into your energy level and into your day. And the last one I have on here is communication. Um, Communicating when we are at our limit instead of pushing past it and burning ourselves out is one of the biggest things that we can do to help with this barrier. If you are tapped out, be tapped out. No one can have 100% of energy all day long. If you have an activity through the day, that is going to draw on some energy. And again, knowing what gives and takes energy is important so that we know what we're coming to our people with, or even coming to therapy with. If we are tapped out from this process and you're about to sit down across from your therapist, talk about that. Say, I'm a little pissed off just getting here. Like I'm coming into this already past my limit, or already tapped out, and have that conversation. And again, start there. A lot of times it's really intimidating to finally get into therapy and realize that you have all this time to talk about yourself and what's going on in your life. And that can be intimidating. So start with even how you're coming in to that and communicate that. Again, not just with your therapist, but with your family members and with your friends. If you have a friend that calls you 3 times a day and you can only handle one of those phone calls, don't answer the second 2 and communicate your needs there. Again, we had a question beforehand about like survivorship programs. Any combined care program is going to be amazing for bandwidth. If you can get multiple services in one place, that is unbelievable. It is hard to find those programs, and I don't have any listed just because I have a very small sample size in the Pittsburgh Erie area. But if anyone is interested in any of the resources that I have, please contact me after here. I will have my email, my phone number, and all of that available to you. So if you are interested in specific survivorship programs in the area that I am in, I'm more than happy to help you access those. Because again, any program that provides multiple different services is going to be huge for your band. But any other questions that have come up for step 2?
Yeah, and just to add that in our follow-up email from this, I can also put in a little bit of information about survivorship programs, survivorship planning. Like you said, it's few and far between. Some of the bigger places are getting on board with that, other places not so much. But one thing that kind of stood out to me was well, first somebody wrote in the chat, they've gone through 3 therapists before finding their current one who is the most helpful.
Yes, I am so happy that you shared that, and I appreciate that so much, because that can be one of those biggest brick walls you can possibly hit, where it's like, this just isn't it. And it is worth pushing through that and finding the right person.
Right. And I think it's reaffirming to know that even that feeling or thought is something you can bring up with the current therapist. And then maybe they're going to say, well, here's this resource, or maybe they're going to think of a therapist in their office or a different office that they think you might be a great fit for.
Mhm.
So I think that takes, I guess, the worry away from, oh my gosh, we're not meshing or we're not vibing. And then I just think it's so important to think about these things and the whole idea of bandwidth around this. Because, like you said, this step 2 can turn into 8 steps in itself. And I think having the awareness and knowing what to do with your bandwidth and knowing you might hit road bumps and, bumps in the road and how to get over those and what to work through, is really just helping people set up for success rather than think it's going to be perfect and, all happy-go-lucky and great. That these are things you need to put in to the process, I think is really important. And we did have a few comments here in the chat, but on the remark of communication and bandwidth, maybe not necessarily for the person seeking mental health support, but do you have any advice or recommendations for someone who maybe their caregiver or their spouse or their close friend isn't really being the most supportive or really on, their side of them saying, hey, I need therapy?
Yeah. Yes, setting boundaries with people and being honest with people, that kind of even goes into that first step we talked about with like working through stigma and working through judgment. Um, I'm a big believer too, and this probably goes against a lot of other therapists and things that people would say, but you also always have the right to only share the information that you want to share. If there are people in your life that don't even know you're in therapy or don't need to know you're in therapy, I personally, I'm all on board for that. There are people in our lives that, whether or not they deserve to be there, they are there. And if they're going to have judgment or if they're going to make you feel uncomfortable about this process, they don't need to know about it either. Um, and as far as like the people that do know and just aren't being supportive, set your boundaries. Boundaries with people that are pushing against us and pushing against our needs are going to be huge draws against our bandwidth. They are going to be the people where it's like, oh my gosh, I'm trying so hard, and you are continuing to pull that energy out of me. And so just paying attention to, like, again, how many times are you talking to this person a day? Do you need to set some boundaries with how often you talk to them, how long you talk to them, and what do you talk to them about? Your question also brought up something that I don't have in here, which is when someone we know needs therapy, which is also a very touchy communication topic. It's the easiest when it comes to like our caregivers, where it's like, hey, I feel like you're holding a lot from my experience, and I'm not responsible for that. You are responsible for that. And so also therapy can be one of those things that can also motivate other people as well. And so it can be something too that if there are people in your life that you also feel would benefit from this process, this can be something where you guys kind of band together and even connect through the idea of getting into therapy. And what that looks like as a family, as friendships, as relationships. Our caretakers go through a lot, caretakers in general go through a lot. And they may be the person that needs to prioritize themselves in a situation and don't always know how,
Right.
because they play that role of caretaker.
Right. And I think even, you kind of highlighted, hey, go into therapy talking about this, so if you're seeing a little bit of a riff, or maybe your spouse or your partner or your caregiver doesn't really understand why that you've made the choice to go to therapy and are in therapy,
Mhm.
ask your therapist how to talk to
Yeah.
them about it. I
Yep.
think is also a really great recommendation.
Yes, absolutely. So moving into step 3, which is our insurance approval or just payment in general for services. So at this point, you've decided you want to engage in therapy. You have found a therapist and you need to pay for that service. So there are kind of 2 avenues that we can take. There is a self-pay side of things. Self-pay is amazing if you can do it, but not everybody can. And not everybody self-pays just because they don't have insurance. Sometimes you choose to self-pay because, and we'll get into this in the next step, like your therapist doesn't take your insurance and you finally found that really good fit. And then something happened, your insurance changes. That just happened with one of my clients. She got a new job, her insurance changed. I'm not accredited with that insurance company. And though we're starting that process, there's going to be a chunk of time that she is choosing to self-pay. And so we have made the adjustments that we need to for her to budget that out and make that happen. But self-pay is always an option. And we'll talk about when we get to the problem solving, what we can look for to make a self-pay track an easier track for you. Your other option, obviously, is insurance. So insurance, I I've been I've had a really hard time narrowing down what I want to talk about with insurance in this time, because this is not a talk on insurance. Um, but ignoring the nuances and barriers that insurance brings up would just not make any sense in this conversation. So we have to touch on it. But again, I'm going to be very kind of picky and choosy with what I bring up with insurance. Um, one of the biggest things, like I had just said, is that therapists need to be approved or accredited. It's what we call paneled with insurance companies. So this is one of the things that not everyone knows about. But not every therapist is allowed or able to take all insurances. So that can be really frustrating when you're looking for a therapist and it's like, they don't take my insurance. It's not always their choice. Some insurance companies won't even panel different licensures. So my license is that LPC title. There's also a social work license, which is your LCSW, and some insurance companies won't panel those people with that license. There's also something we call a provisional license, which is kind of like a license in progress. And again, some insurance companies will cover those, and some insurance companies won't. There's also sometimes just problems in the process of getting paneled. I have an insurance company that I've been fighting with for about 10 months now to get paneled with them. And they're a very popular insurance company that a lot of people have. It's not, it's not an off to the side bunker insurance company. It's one of the top. And I had a client who came in. I said I was in that process. They started with self-pay, thinking that that process was not going to take as long as it has. And then they had to find a new therapist because they couldn't afford to self-pay. And I am trying my hardest and just can't, like, I'm not hearing back. The paperwork isn't coming through with that insurance company. So one of the things just that I want to bring up from the therapist side of things is keeping in mind that insurance, as frustrating as it is when a provider doesn't take it, there is more there than just they're choosing not to. I get a lot from people that it's like, oh, you don't get paid enough for my insurance to take it. That is not the case. Most of the time, it is that I either can't get paneled with them due to my license or different things like that. Or even for me to be able to maintain, because every year we have to also maintain our accreditation with insurance companies. And for me, being a private practice independent contractor, that is just hard for me to do if I take all the insurances in the world. So that is kind of those are your two payment options. So very clearly, our barrier with step 3 is cost. How are we going to pay for this? And so I'm going to go into kind of things that can vary our cost. And that's what I've decided to kind of talk about a little bit more when it comes to cost. So the first thing that I want to talk about are terms that can vary your cost. And so these terms are going to include coinsurance, copay, deductible, and out of pocket, your out of pocket max. So your coinsurance is when your insurance company, essentially it's a percentage format of a deductible. And so your insurance company will ask you to pay a percentage of a rate. Those rates are based on an insurance contract with each therapist. This can vary from therapist to therapist, even within an office. So for example, if you have 2 children that are seeing 2 different therapists at the same office and your payment is based on a co-insurance, you could be paying differently for each of those children to see a therapist within the same office. This is because different contracts with insurance only agrees to pay therapists on what, I'm going to choose my words wisely and not get on my soapbox, based on what they agree to pay the therapist. So that can vary depending on your licensure, your education level, where you live in the world, where you practice in the world, and all of those things. So again, those costs can look different. It's not because a therapist is charging you differently. It's because your insurance company is kind of compensating differently. Your copay is a fixed flat rate that you pay per session. And that can vary based on like if your deductible is met, and we'll talk about that next, or if your insurance changes, that can sometimes do that too. Your deductible is that dollar amount that you have to hit yearly before your insurance company will start to pay for things. So again, that can kind of vary your cost on depending on what your deductible is and where you're at within your deductible. And that is a thing that therapists don't always have accurate information on. I think I have that point a little bit further down, but I'm going to mention that again, because that can be really frustrating when a therapist will say, like, I don't know what your bill is going to be. That's because we don't always have that accurate information of where you're at in your deductible. So we can give a best guess, but we don't always know what it's going to be. And then your out-of-pocket max is the most you will ever spend. And again, this resets each year. So, you know, if your employment changes, those types of things, that can change what that payment looks like. Our next category are plans that can vary your cost. I'm not going to get very specific here just because there are so many plans and that would be impossible. But this goes into like in network, out of network, you know, but that can be something where it's like you and your friend have the same exact insurance, you know, but you have different plans, different plan types, and that can change it as well. And then situations that can vary your cost. These things that can come up where it's like you're used to paying a cost and then something happens and that changes. So not meeting medical necessity is one of those things. That is when your insurance company comes back and says, we're no longer going to pay for sessions. Either you got audited and they feel like you reached your goals, or they just have a limit on how many mental health sessions that you can receive each year. Those types of things. So that can happen where an insurance company will say, we're no longer paying for this service. Therapists can try to fight this, but we don't always win. So that is a time where sometimes you have insurance, you have all the pieces that you need, but then sometimes even you reach your goals and so you don't meet the medical necessity, but you just want to stay in therapy because you want a place for yourself to have a conversation with a professional. And so that's when you would have to switch to self-pay. Costs being met, like your deductible, those things can kind of change. So if you're paying a price because you haven't met your deductible and then you do meet your deductible, then either that co-insurance or copay might kick in and that can change your cost. Again, we don't always have accurate, you know, numbers here. And so it's hard to know that. Any insurance changes if you are on a partner's plan or a family member's plan, ask them when their year date is up. It's not always January. And sometimes employers will change your benefit packages. And so knowing if you're on someone else's insurance and their employer changes what their benefit package is going to be for the new year, and you're unaware of all of that, and then you go in for your session and your claim gets denied, and then your therapist comes to you and says, hey, insurance refused to pay for this. You know, how do we want to handle that? And different offices will handle that differently. You know, but that's one of those things that could really shock people and really, again, kind of knock the wind out of your lungs when you've gone through all of these steps to get there. And then there's an issue with your insurance. And so paying attention to those year changes or company changes. Also, just like if HSA, if you have a health savings account in that account, you can give that card directly to providers and they can charge that. But if that account then reaches its limit, that might be a change in your payment as well. I have worked with people before when they start to get low on their HSA that we just start to spread sessions out. And again, we'll talk about problem solving some of the cost barriers, but you know, that can be something again that can impact payment and cost. And I kind of just have an asterisk here of remembering that insurance companies are always changing the rules. They're always changing the rules and legislation without provider or consumer knowledge. And so just getting involved kind of again in that process, call representatives and ask those questions because there are changes happening all the time that even I learn about after I've already put a claim in for somebody, or you know, different diagnosis changes where they're just starting to deny those claims. And I didn't even realize those changes took place because the conversations aren't happening out in the open. So just being very patient with those changes and getting involved in what that process looks like. One of the things with that, and I added this later, is that idea of if your service for mental health, sometimes insurances will bill it as a mental health service and others will bill it as a specialist service. This is also something that as a therapist, I have no control over. But it is a conversation that you are allowed to have with a insurance representative. And so if you're paying more for a session because they're calling it a specialist service, please call your insurance company and talk to them about this, because you might be able to save some money by switching it to a mental health service. A lot there again with insurance, but I want to go to some problem solving when it comes to cost, which is that third step kind of in this process. So again, call your insurance, ask your questions, ask all of your questions, and talk to an actual person. Work through all of the press ones and press twos to get through to a person and ask them your questions. One of the quotes, and maybe we can put this in the chat, is to ask for an explanation of benefits. So that's an explanation of benefits. This is where they will talk through what your costs are and what your services are. That's where you can talk about, is your mental health being paid for as a mental health service or as a specialist service? And so ask for that and get that information. Our office runs that information for you, and we do what we call a best estimate, but not all offices do that. It's actually very rare that an office will do that. And so I promote all of you to do that yourself. If you go through those steps, you want to get a therapist, you find that therapist, call your insurance company and verify that explanation of benefits, and get a best estimate from your insurance company of what they think your cost will be for that specific therapist, or for that specific service. And again, that can always come back differently. Like I said, we don't always have best estimates. So we might put a bill in and your deductible wasn't met, and then your deductible is met, and then we'll come back and have to redo that bill because now your co-insurance has kicked in. And so, you know, talk to your insurance. If you see an issue on your bill, call your insurance and talk to them, and verify your benefits always with your provider. Especially again, if you get a bill that has something on it that you don't understand, call and talk to your insurance company. I have following policy changes because again, that's a little bit of a soapbox one for me because insurance companies are always making those changes. And it always feels like we should know that stuff, but we are not actually told that information. And so just getting involved with policy change and legislation when it comes to insurance companies as well. And again, pay attention to your plan and to your plan changes, especially if you are on someone else's plan. Again, whether it be a spouse, a partner, a family member of any kind, you need to understand your benefits no matter what. And so if you are on someone else's plan, either have them walk through that plan with you, or again, talk to the insurance company directly, go onto your like my provider website and get that information, so that you understand all of the things that go along with your insurance. Things to look for if you are a self-pay and trying to kind of get around this barrier of cost. You can always look for sliding scale, and that can be something you can search for, kind of a look for in that Psychology Today. A sliding scale is where they will adjust what you pay per session based on income, or other situations that they provide that sliding scale for. You can also ask to work with an intern or someone under a provisional license. Those are usually cheaper sessions because again, you're either not going through insurance because the insurance won't cover those sessions, so it's self-pay, but at a lesser amount than if you were to see a licensed therapist. And as a person that at one time was not licensed, there are great interns and great professional license people out there that are getting experience and are working really, really hard and know their stuff. So don't be turned off by an intern or provisional license title. And then working around your deductible, I have in my notes too, when it comes to budgeting out for sessions, you can always change how often you are seen by a therapist, spread out your sessions, and work around your deductible. If you know that you have a bunch of appointments right off the bat at the beginning of the year, then slow down your therapy sessions during that time. Once you hit that deductible, that might be where we start to, again, even start this process from the beginning. Or you've already found someone and you want to kind of work into that. I have a ton of people that at the new year, they're like, let's spread out. And we do. And then when they hit their deductible, we jump right back in. And as much as that's not our ideal situation when it comes to a therapeutic process, we have to do whatever is going to make you successful. And if that is it, that is what we will do. So just kind of the things on that. I do have some blogs as well that I want to put in the chat. We have blogs from our site on the navigating the insurance maze, as well as selecting benefits. So we have 2 blogs there that specifically go into what to look for when you're selecting your insurance, especially when it comes to their mental health coverage, and just the insurance maze in general. It has all of those terms defined and kind of how they play a role in your cost. So I know that that is so much when it comes to insurance, and that can be a really, really, really frustrating barrier to hit. But it is worth it to come through to the end and find someone that can work through your days and your years and your life with you and be kind of a partner in this journey with you. So just in conclusion, we have our 3 steps. 1, deciding that you are ready to engage in the therapeutic process and fighting through that barrier of time to get there. Finding the right therapist for you and being willing to search for that person and try different options until you find the right fit. And then getting insurance approval to cover costs or budgeting out for a self-pay financial solution for your care. That is what I have for you guys. I am open to questions. I am happy to stay and answer any questions. I also have all of my personal contact information here for you. So if you want to send me an email, give me a phone call. If you call me and I don't answer, please leave a voicemail. But feel free to give me a call or even send me a text. Let me know who you are and that you were in this presentation, and ask whatever questions that you have. And then I also have my company's website there, where you can access. We have a ton of blogs, not just on the insurance, but on all kinds of things that could also be some of those ways that you get involved in your mental health process, without seeing a therapist or kind of while you're waiting to get in with a therapist. So we have a ton of great resources on our website, no matter where you live or where you're located. And you can also just kind of get examples of getting started pages or looking through therapist